Well, it seems that the fourth wave is imminent with a steep increase in cases in Gauteng in this latest daily report. Now, of the 1,275 new COVID cases nationwide, Gauteng has recorded over 1,000 of those. Let's find out what the experts are saying as far as the country and its vaccination targets are concerned, and how worried are we? Always a pleasure. Wits Professor Alex van den Heever. Hello to you, Prof. Good to have you with us. Were you surprised by last night's numbers? How worried are you?
I'm not surprised once you see the 7-day sort of moving average trend, which is giving an indication, eliminates the sort of daily moves. And even up until yesterday, the trend was significantly upward, and it's a deviation from the sort of trough that it's been in for a while. So once it gets into this trend, it tends to become exponential. And that's kind of what we're seeing. So it really does mean that we're looking at a wave beginning in Gauteng and potentially in Tshwane, and it's potentially amongst students initially. And that's probably where a number of super spreading events have probably occurred. And after that, it tends to trigger a sort of wider set of infections.
So it seems the data not leaving you particularly surprised. How concerned are you, though, as we head into December, knowing that a lot of people then start travelling to holiday destinations and possibly to home? And Gauteng, Prof, seems to have the highest numbers. Not seems to, it does have the highest numbers. And we all scurry off to the coastal areas over December, don't we?
Yeah, so we've had continuous transmission all the way through since April last year. So that has never ended. So I don't think that we're seeding new epidemics from Gauteng into other areas. What's probably happening is that there are a number of sort of coincidental social activities that are probably driving this. And we are seeing an earlier move in Gauteng than we did last year. But what we see is a number of things. Firstly, we definitely are connected somehow to the waves that occur in Europe, and we're also during their winter, and so we have a summer wave, and then we also have activities that begin in December that drive a wave, as we had last year. So what's not unsurprising is a wave beginning in December. The question really is how severe it will be and whether or not we will have a lot of deaths given vaccinations. But our vaccination levels are not at sufficient levels to prevent a lot of severe illness and death.
Prof, I do want to ask you about the vaccination levels in a moment. I hope you don't mind me putting this question to you, though. I'm seeing reports coming out of the United Kingdom that what they're calling, and I want to quote this, a COVID super variant with 32 mutations found in South Africa, Botswana, and Hong Kong. It's this variant, and it's, I'm going to read it as it is. I hope I get this right. It's the B.1.1.529 strain. Does it mean anything to you? How worried should we be about this? What have you heard?
Well, I think that it's early days yet. So the question really is whether this escapes the vaccines. It is worrying that such a variant has occurred, but I think it's also inevitable in a way that we're going to see this. The real question is whether basically past infections as well as vaccines will still protect us against this particular variant. And I haven't really seen any analysis of that yet. South Africa is keeping sort of a close watch on new variants, doing the genomic analysis. The question also is whether or not this particular variant is going to be more infectious than, for instance, the Delta variant, and therefore might actually spread very quickly. We don't know.
No, we don't. And just on the back of that, before I move to vaccinations and possible lockdowns, Prof, this variant has 32 spike mutations. I'm sure that means more to you than it does to me. The Delta variant has 16. So I'm sure we're going to be watching this very closely, but that's coming out of the UK. Of course, we'll wait for experts such as yourself to unpack what that means for us if we get to that point. Can we talk the vaccinations and lockdowns? What do you expect as we head quicker and quicker into the festive season, Prof?
I think that we may. So in terms of vaccinations, we've seen a drop-off in the number of people coming forward, which is really problematic, given that we actually have ample vaccination stocks. And a lot of people who potentially would be at risk because of comorbidities, etc., have also not come forward. So that means during this wave, we do have faced the possibility of people developing severe illness and dying, and also the hospitals filling up. So I think this is a serious problem coming now, and we probably will have a limited set of restrictions, but I do expect government to be fairly careful about that, because we essentially can't take the economic knock anymore in South Africa. So we might have to ride out a lot of this.
Riding out might be the only way to go, but we'll wait to see what happens as we get closer and closer to December as well. Very worrying numbers, but always a pleasure, Prof, to speak to you. Alex van den Heever, public health expert, joining us this morning from Wits University.